Okay, so now what we're going to do, we're going to think about our health and well-being, and our back is really important. So I don't ever want to see us bending over to a patient. I want us to think about ergonomics and keeping our back straight. Now for tasks such as this, we need to lift the bed up, and most beds now have the remote control to lift. So now let's lift the bed up to a hip working height, so we're not bending over and putting strain on our lower back. After you've done this a couple of times, you'll realise that you'll end up with lower back pain if you don't. Okay, so we've now got our bed to a good working height. Now, let's start to gain consent and talk to our service user and customer around their wishes and needs. So hello George, my name's Stephen. Today I'm going to wash your hair. Is that okay? And hopefully you'll get consent. Yes, Stephen. Wonderful. So, we've now gained consent from our patient and we're going to explain what we're going to do. So George, I'd like you to sit up and I'm going to place the sink under your neck. And then what we'll do, I'm going to place a towel to capture any water. Is that okay? Yes, Stephen. Wonderful, George. Right, so we're going to move the pillow and we're going to place the sink under George's neck. And you've got your little flaps here to go round. Now, you can take a little towel as well, and you can slide that under just to capture any water as necessary. Okay, so we've got George in a nice position. We've got the sink, it's inflated. Make sure that it's nice and firm, and make sure the plug is in. Now, you don't need a lot of water as you do this. Now, I always think for patient care, it's nice just to pop a flannel over the customer's eyes, just in case you get some shampoo in them. So George, I'm going to place a flannel over your eyes. Is that okay? Yes, Stephen. Thank you. There. So now George can't see. Communication's really important because we blinded him. Now what we're going to do, we're going to take a little water from our bowl, and I'm going to say, George, I just want you to test the temperature of this water. I'm going to dip your hand in the cup. Is that an okay temperature for you, George? And hopefully they'll say yes. Now obviously if you're wearing gloves and you dip it in water, you're not going to feel that temperature as much as they will. So we're going to hold the flannel over his eyes so the water doesn't go in. And I gently arch my hand across the forehead as a barrier as well. And as we pour, I'm going to say to George, George, I'm going to pour the water now. Here we go, George. And you only need a little bit of water to wetten the hair. And just start to massage the scalp to get the water all the way through. Lift the back of the head up and go forward. Now you can see you don't need a lot of water for this task. George, I'm going to put some head and shoulders on your head now, and we just put a pea-sized amount on. And again, we're going to rub it into our hands and massage it into the scalp. And as we do that, we can talk to George and ask him how his day's been, if he's got any plans. So George, you up to much today? Oh, not really, Steve, I'm just going to lazy. Okay, George, do you have any favourite music that you listen to? So we're just trying to build a bit of a therapeutic relationship whilst we're doing this. We're going to go up behind the ears and keep massaging the head. We'll ask him how that feels. How does that feel, George? Oh, that's nice. Wonderful. Okay, so once we've finished, we'll get the rest of our water. And again, we just pour gently over the head, saying to George, George, the water's coming, and we can take the rest of that water off. So you don't need a lot of water when washing his hair. So, once we've finished washing, and all the shampoo's off, we need to grab a towel, and we're going to just gently take the top of the towel and wipe and remove the flannel. And as we remove the flannel, let's wipe the forehead so no water runs into George's eyes. We're going to dry the hair, and again we can lift the head, and the towel that we placed here we can use to bring up, and then we can move the sink. Now when you remove the sink, just be very careful, but you can see there's not a lot of water in there. We can place that down and we can finish drying George's hair. Now when we're drying George's hair, It's important that we look in his ears and not yanking his head side to side, but we move and look in his ears just to make sure that they're clean and behind the ears. Okay, there we go. So we're going to finish off and we'll remove the towels and we're going to pop our cushion back. We'll pop his hand back under and make sure he's comfortable. We're going to ask George how he feels. So George, how does that feel? Oh, that's really nice. Wonderful. And we're now going to take our gloves and our apron off. And as we take them off, we don't flick them, we grab it all in our hand. So all of the infection is on the inside and we'll pop it in the bag. It's really important now that once we've washed his hair, we style it in the way that George likes. So you can see there's a centre parting, so we would comb that to the side and then we would write that in the care plan. That's how to wash hair. Thanks for watching.